In the United States, now the country hardest hit by the coronavirus, disaster has been declared.
Both in the U.S. and on the international stage.
And the U.S. is also struggling.
New York City is ground zero.
African Americans being hit disproportionately hard by the virus. In Chicago, they comprise only 30% of the population, but account for a staggering 72% of death.
And then there's this grim reality emerging, that African Americans have been hit hardest by the virus. Despite accounting for 14% of Michigan's population, they represent 41% of its COVID victims. And in Detroit, with a majority black population, more than a third of them poor.
Again, the virus doesn't discriminate, but the disparities that have long been part of our medical system in America are now leading to what some call a crisis within a crisis. Black and brown communities across the country being hit harder, in greater numbers, and with fewer resources to save them.
Thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
Imagine with me for 1 minute a fully loaded jumbo jet with 200 passengers and crew taking off from Boston's Logan Airport and crashing today, and everybody on board dying. And the same thing happens every day for the rest of this week, and every day next week, and every day next month, and every day for a year. That's what we mean when we say that there are racial disparities in health in the United States. Over 200 African Americans die every day who wouldn't die if they had the same health experience of whites.
Is this racism?
I don't know.
First step in solving any problem is recognizing there is one. America is not the greatest country in the world anymore.